Think about those moments, after a big health event. When you're starting that climb back to doing things for yourself, that whole journey, it's
Yeah.
so often shaped by rehabilitation.
Mm-hmm.
But what really makes rehab work? What are the key things that actually lead to real progress?
Yeah.
That's the big question we're really digging into today.
Absolutely. We're trying to move past just the general idea of getting better. Our aim here in this deep dive is to pinpoint those core elements that make rehabilitation services genuinely high quality, the things that create lasting, positive change. And we're drawing from a pretty comprehensive set of information, actually.
Yeah, the sources are fantastic for this. We've got insights from, global heavyweights in healthcare standards like Joint Commission, International JCI, and the National Accreditation Board for Hospitals and Healthcare Providers, NABH, over in India.
Right. Important place.
And we're also looking at practical expertise from Supreme Medic Consultancy, the broader view from ISQA, that's the International Society for Quality in Healthcare, and some really focused research on, how to actually improve rehab services.
It's a great mix.
So, let's kick things off and really try to understand what makes rehabilitation truly effective.
All right, let's get into the heart of it then. When we talk about quality in rehab, it's not just one single thing. Our sources really emphasize that it's a combination of different factors.
Okay.
A helpful way to think about it, one framework, is looking at structure, process, and outcomes.
Structure, process, outcomes.
Right. Think of it this way. You need the right foundation. That's the structure. Things like facilities, equipment, staff numbers, maybe.
Got it.
Then you need the right way of doing things, the right delivery of care. That's the process.
Mm-hmm.
And ultimately, what really counts is the result for the patient. That's the outcome.
That makes perfect sense. It's kind of like building a house, isn't it? You need good materials.
Yeah.
That's structure. Skilled builders.
Yeah.
The process.
Yep.
And a final house that's actually safe and comfortable to live in the outcome.
Spot on. Now, one of the sources also talks about these pillars of quality.
Ah, yes, the pillars. What are those about? Sounds foundational.
They really give us a more detailed view, drilling down a bit. First, there's access.
Okay.
Making sure people can actually get the rehab services they need when they need them, not months later.
Crucial.
Then there's continuity. So important for a smooth journey, especially when patients move between, say, the hospital and outpatient care or home.
Avoiding those gaps in care.
Precisely. Next up is multidisciplinary care. This highlights that it really needs to be a team effort.
So not just one therapist working alone in a silo.
Exactly right. You might have a physical therapist, an occupational therapist, maybe a speech therapist, a doctor, a social worker, all collaborating.
Makes sense.
Then there's goal-directed care. This really stresses how important it is to tailor the plan to what each individual actually needs and wants to achieve. Their personal goals.
Right. Not a one-size-fits-all approach.
Definitely not. Following that is function-based outcomes. This means we're measuring success by looking at real, tangible improvements in what the person can actually do day to day.
Like getting dressed or cooking a meal.
Exactly, those kinds of things. And finally, equity. Making sure quality rehab is available to everyone, regardless of their background, where they live, or their circumstances.
That's a really comprehensive set of pillars.
It is. And what's interesting is how these pillars really connect back to that structure, process, outcome idea we started with.
How so?
Well, ensuring access and equity, for example, that requires a certain organizational structure, right? Policies, funding.
Right.
While the multidisciplinary and goal-directed approaches, those are key parts of the process of care.
Okay.
And ultimately, we're focused on those function-based outcomes. So you see it all links together nicely.
Okay, that clarifies the what quite well. So we have a clearer picture of what quality rehab looks like. But let's dig into the why. Why is this focus on quality just so incredibly important? What's the real-world impact here?
Well, our sources are very clear on this. High-quality rehab directly influences some of the absolute fundamentals of a person's life after a health event. Like their ability to live independently, to get back to work, or, other activities they value, and ultimately their overall quality of life. It's also vital in managing the long-term effects of conditions like, say, stroke, spinal cord injuries, or recovery from major surgery.
And it's not just about improving things, it's also about stopping things from getting worse, isn't it? Preventing complications.
Precisely. That's a key point. Our sources highlight that, well, inadequate rehab or delaying it can lead to preventable problems. Things like muscle contractures, where joints get stiff.
Ouch.
Pressure sores, even mental health issues like depression, which can be common after a major health change. And furthermore, when care is fragmented, maybe the communication between different services is poor, or there are just unnecessary delays in starting therapy, it can unfortunately lead to avoidable long-term disability. And that has huge personal costs, obviously, but also significant costs to society.
It's really powerful hearing some of the hospital leaders talk about this, too. We saw comments from people like Alex Land and Shiji Kurian about their experiences, particularly with JCI accreditation.
Mm-hmm.
They mentioned things like improved teamwork, better learning opportunities for staff. It seems the benefits spread beyond just the patient.
Exactly, and that's significant. It shows that striving for quality, maybe through a formal process like JCI accreditation, isn't just about getting a badge.
Right.
It actually helps cultivate a more effective, more innovative healthcare environment overall. Ahmad M. Sadek and Roxana Fulton also pointed this out. Things like gaining a competitive edge, building stronger community trust.
Oh, interesting.
Improving how risks are managed, and really fostering a culture where safety is paramount right across the organization. It underlines that quality rehab isn't just about the therapy itself, it's about the whole system working well.
Okay, so if a hospital or a rehab service is really serious about improving quality, where should they focus their efforts? What are the main targets, the key goals for quality improvement?
Yeah, good question. Several key QI goals pop up repeatedly in the sources. One of the absolute most critical is starting rehab early.
How early are we talking?
Ideally, within the first 24 to 72 hours after whatever event happened, the stroke, the surgery, the injury diagnosis, that early start can have a really profound positive impact on how well someone recovers.
Right, like you said, hitting the ground running, basically, to maximize recovery potential. What else?
Reducing unplanned hospital readmissions is another big one, and minimizing the risk of long-term disability. Those are critical objectives.
Makes sense.
Naturally, a primary goal is always improving functional outcomes, helping patients get back their abilities, their independence. Enhancing satisfaction is also key, and that includes both the patient and their caregivers. Their experience really matters.
Absolutely. Often the unsung heroes.
For sure. And finally, better coordination of care, making sure everything flows smoothly as the patient moves between different settings. Hospital, outpatient, home care, wherever they need to go.
And how do you actually track progress towards these goals? You need some way to measure improvement, right? What are the core quality indicators?
Right, you need data. Our sources lay out several core quality indicators. For timeliness, for example, you'd track the percentage of eligible patients who actually start rehab within that target window, say 48 hours.
Okay, clear metric.
For functional outcome, you'd use standardized assessment tools. You mentioned a couple earlier, the Barthel Index or the Functional Independence Measure, the FEM.
The FEM, right? What does that actually measure?
Think of the FEM as a way to put a score on someone's ability to do everyday tasks. Things like dressing, eating, walking, problem solving. It gives an objective measure, allowing us to track progress in a quantifiable way, from admission to discharge, for instance.
Okay, so you get a real number showing improvement in daily function. What about ensuring that smooth care journey you mentioned? Continuity.
Yeah, for continuity of care, a key indicator would be something like the percentage of patients who have a really well-documented discharge plan.
Yeah.
That includes things like necessary referrals being set up before they leave.
Got it. Planning ahead.
Exactly. Access can be measured by looking at things like average wait times for outpatient appointments. Can people get in reasonably quickly? To gauge patient-centeredness, you might track the percentage of patients who have clearly documented individual rehab goals that they helped set.
So they're involved in the process.
Absolutely central. And of course, satisfaction, you can monitor that using tools like the Net Promoter Score or just by directly asking for feedback through surveys or conversations.
Okay, so we know the goals, we know how to measure them. Now let's get practical. How do rehab services actually make these improvements happen? What are the specific interventions and strategies that work?
Great question. Several effective QI interventions are consistently mentioned. Implementing specific protocols for early rehab activation is crucial, especially for conditions like stroke or after major trauma. Getting things started quickly.
Right.
Having strong multidisciplinary teams that actually meet regularly to discuss patients and coordinate their care plans, that's essential.
Communication within the team.
Vital. Then, really comprehensive discharge planning. This isn't just a quick chat. It includes educating family members, providing clear home exercise programs, arranging follow-ups. It's about ensuring a successful transition back home.
So it's not just about the therapy sessions themselves, but also setting the patient and their family up for success after they leave the service.
Exactly, that continuity piece again. Ensuring staff competency is another key intervention, making sure therapists and other staff have ongoing education, that they're up to date with the latest techniques through continuous training.
Always learning.
And the importance of using data for improvement, can't stress that enough. Regularly collecting and analyzing outcome data lets services see how they're doing, benchmark against others maybe, and pinpoint where they need to improve.
Using the numbers to drive change.
Precisely. Actively engaging the patient is another big one. Shared goal setting, using tools like rehab diaries, maybe even tele-rehab check-ins.
Right.
And finally, having the right infrastructure. You need adequate therapy spaces. You need access to the right assistive devices and technology. That's the foundation.
And there's a really good example in the sources about using that PDSA cycle, wasn't there? Plan, Dose, Study Act. Can you walk us through how that worked in practice?
Absolutely. The PDSA cycle is such a useful, practical tool for making changes step by step. The example given was about speeding up how quickly stroke patients started rehab. The problem they identified was delays in getting the referrals processed, just paperwork bottlenecks, you know?
Oh, yeah.
The plan was to introduce an automated referral system within their electronic medical records.
Makes sense. Streamlining it.
They then they implemented the system, trained the staff. Next, they studied the impact. They looked at the time it took for referrals to get processed before the change versus after.
Okay, measuring the difference.
Exactly. And the act step would then be, okay, this worked well, let's roll it out fully. Or, it needs tweaking, let's adjust the plan and try again.
And what was the result in that example?
Their reported result was impressive. A 65% improvement in getting rehab started on time within just 3 months. It's a great illustration of how taking a structured, methodical approach can lead to really significant improvements.
Wow, 65% is huge. That's a really clear example of how a system change can impact care.
And our sources also mentioned some sort of broader, maybe more overarching strategies for quality improvement. Yes, absolutely. Beyond specific interventions, there are key strategies. Formally establishing quality improvement initiatives within the organization is one, really making it part of the structure, often using frameworks like that Donabedian triad we discussed. Structure, process, outcome.
Right, building it in.
Robust data collection and crucially rigorous analysis are essential to actually inform these initiatives and track if they're working.
You can't improve what you don't measure.
Exactly. Creating effective feedback mechanisms is another. Patient surveys, maybe focus groups, making sure you're hearing directly from the people receiving the care. Their perspective is invaluable. Fostering strong collaboration and open communication among all the different professionals involved in a patient's journey is vital. Breaking down those silos we talked about.
Yeah.
And underpinning all of this is the need to cultivate a real culture of safety and continuous learning within the entire rehab service. Everyone needs to feel empowered to identify problems and suggest improvements.
It's fascinating to see how different places are tackling this. The sources highlighted some really interesting, innovative models from different countries, didn't they?
They did, yeah, some great examples. Singapore's integrated rehab at home model sounds fascinating. They have specialized community teams going into the patient's home.
Oh, wow.
And a big focus is on training family members and caregivers to support that long-term independence right there in the home environment.
Very practical.
Then you have Sweden's rehab coordination centers. That's a more centralized approach. They use dedicated case managers and unified patient records to help guide people smoothly through the whole rehab system.
Better navigation.
Exactly. And in India, the early mobilization project at AIIMS Delhi is getting great results. They're starting rehab really early, even for patients still in the ICU.
In the ICU, really?
Yeah, and it's been shown to reduce complications like delirium, which can be a big issue for critically ill patients. So these examples show different ways of thinking about how to deliver and coordinate care effectively.
It definitely sounds like there's a global push towards rehab being more integrated, more focused on the patient's whole journey, and more proactive.
I think that's right.
And technology is obviously playing a bigger and bigger role in all this, isn't it?
Oh, absolutely. Digital and AI tools and rehabilitation QI quality improvement are really taking off.
Like what kind of tools?
Well, telerehabilitation platforms are huge for expanding access. Think about people in rural areas or those with mobility issues getting therapy remotely.
Yeah, huge potential there.
Wearable devices like smartwatches or sensors can give therapists really valuable data on how patients are progressing, whether they're doing their exercises between sessions.
Keeping track remotely.
Yep. Artificial intelligence, AI, has enormous potential. Analyzing huge data sets to maybe predict recovery patterns better or personalized treatment plans more precisely.
Interesting.
And even virtual reality, VR. It's being used to create really engaging, interactive exercises for both cognitive rehab, like memory or attention training, and motor rehab, practicing movements in a safe, simulated environment.
Okay, so for all these great ideas and initiatives, the models, the tech, the QI efforts to really stick and be successful long-term, what needs to be in place? What are the key success factors?
That's critical. Sustainability. Strong clinical leadership is number one. You need champions within rehab medicine, people really driving these quality initiatives forward.
Leaders who believe in it?
Absolutely. Supportive policies are also crucial both within the organization and at the government level. Policies that ensure rehab is properly funded and seen as an essential part of the healthcare system, not just an add-on.
Right, integration.
Exactly. Expanding community-based rehab networks is another factor, getting care closer to where people live. And as we've touched on, including specific rehab quality metrics and hospital accreditation standards like those from JCI and NABH, that really provides a strong incentive for continuous improvement.
Makes it mandatory in a way.
It certainly focuses attention. And finally, recognizing and providing real support for caregivers. They are so often the backbone of the rehab process at home, and they need resources and support too.
Definitely. And it's so important as we pursue quality that we also keep equity front and center, isn't it? Making sure these improvements benefit everyone.
Couldn't agree more. Rehab QI and equity is a vital consideration. It involves several things, like ensuring facilities are physically accessible for people with disabilities, ramps, accessible restrooms, adjustable equipment, developing rehab plans that consider gender-specific needs or health issues.
Okay.
Integrating mental health and psychosocial support as a standard part of rehab, not an afterthought. Prioritizing outreach to underserved areas like rural communities who often have less access.
Bridging that gap.
Yes. And things like providing access to assistive technology banks for people who can't afford necessary devices. All of these are crucial for making quality rehab truly equitable.
It's clear that improving rehab quality is a huge global undertaking. And there are some key organizations really driving this forward on a larger scale.
Yes, definitely. Joint Commission International, JCI, is a major one. They're recognized globally as a leader in pushing for better healthcare quality and patient safety overall.
And their standards apply to rehab too.
Oh, yes. Their standards provide a really comprehensive framework that services, including rehab, can use to evaluate themselves and find ways to improve. They also have those specific international patient safety goals that accredited organizations have to meet.
Right.
And JCI does more than just accreditation. They offer various certifications, advisory services, they publish resources, run educational programs. Their reach is massive, over 70 countries, thousands of accredited programs.
Wow. And then we also looked at NABH in India. What's their specific role?
So NABH is part of the Quality Council of India, and their focus is squarely on establishing and running accreditation programs, specifically for healthcare organizations within India. They set the benchmarks for quality and patient safety there.
Okay, a national body.
Exactly. Then there's ISQA, the International Society for Quality in Healthcare. They're different, again, a member-based nonprofit organization, truly global. Their mission is promoting quality improvement worldwide through things like education, sharing knowledge, and external evaluation of healthcare standards. Their big international conferences are key events for people in the field.
Bringing people together.
Precisely, for collaboration and learning.
And we also saw organizations like Supremedic Consultancy mentioned. Where do they fit in?
Yeah, organizations like Supremedic play a really practical role. They offer direct, hands-on help to hospitals and other providers. They assist them in setting up robust quality management systems and navigating the accreditation process itself, especially with bodies like NABH. It can be complex, so they provide that crucial support.
Sound like guides through the process.
That's a good way to put it, helping them understand and meet all the specific requirements.
So looking ahead now, based on everything we've discussed from the sources, what does the future hold? What are the anticipated next steps or directions for quality improvement in rehabilitation?
Well, several key trends seem to be emerging. We're likely to see more countries developing and implementing national rehabilitation quality frameworks, sort of standardized guidelines for quality, ideally aligned with global standards from organizations like the World Health Organization.
More consistency across the board.
Hopefully. There's also a growing push to include vocational rehab metrics more formally. Things like return to work rates, measuring success not just by physical function, but by participation in life roles.
That makes a lot of sense. Getting back to work is a huge goal for many people.
It is. We can also expect to see wider adoption of community participation models rehab that actively helps people re-engage with their communities, not just stay within the clinic walls.
Taking rehab out into the real world.
Exactly. And finally, the use of digital tools is only going to increase. Things like national digital rehab registries could become more common, allowing for better benchmarking of data and tracking quality progress on a much larger scale.
It's just so clear from this whole deep dive, isn't it? Providing quality rehabilitation is so much more than just, helping someone lift their arm again.
Oh, absolutely.
It really demands this incredibly comprehensive, thoughtful approach. Considering every single aspect of a person's recovery, their whole journey back towards a life that feels fulfilling and independent for them.
You've summed it up perfectly. The pursuit of quality in rehab, it requires real meticulous attention at every single level. From the basic building blocks, the infrastructure, the staffing, right through to the deeply personal experience of each individual patient. And of course, using data and technology smartly, not just for the sake of it, but to genuinely drive continuous improvement.
So, considering this really multifaceted nature of quality rehab that we've explored today, everything from access and coordination to being patient-centered to using technology effectively, what single change do you, listening now, believe would have the most significant positive impact on patient outcomes, maybe in your own context or your community? It really makes you think, doesn't it? How all these different pieces are so interconnected and how crucial each one is in shaping someone's recovery journey.